Good afternoon and welcome to our latest episode in our conversational event series with today's most exciting thinkers on the big topics related to our missions and innovation methods. My name's Jonathan Bone, Mission Manager for the Healthy Life team at Nesta, the innovation agency for social good. At Nesta, we design, test and scale solutions to society's biggest problems. Our three missions are to help people live healthy lives, create a sustainable future where the economy works for both people and the planet, and give every child a fairer start. Today, we're going to be talking to Professor Kevin Morgan. Kevin is Professor of Governance and Development in the School of Geography and Planning at Cardiff University. His research interests revolve around three main themes: place-based innovation policy, multi-level governance, and sustainable food systems, where he is focused on the role of public food provisioning. In his new book, Serving the Public, The Good Food Revolution in Schools, Hospitals and Prisons, which was published just a few weeks ago, he argues that public procurement can help to fashion a fairer, healthier and more sustainable food system if it is deployed with professional skill and political purpose, and if it is integrated with policies to support the production and consumption of sustainable food. Kevin's book, I think, really highlights how food is such an important multi-level, multi-issue topic that crosses Nesta's Healthy Life, Fairer Start and Sustainable Future missions. Before I start, I just wanted to invite our audience to join the conversation in the comments box on the right-hand side of your screen. And please do ask any questions throughout the event. Closed captions can be accessed via the LinkedIn live stream. Good afternoon, Kevin.
Hi, Jono. Good to see you.
Good to see you. I know we've had a few interesting conversations in the past about school food, so I'm really looking forward to talking to you a bit more broadly about public food and, of course, your new book. I guess just to kick off, you frequently use the phrase the public plate. What exactly do you mean by this, and why is the public plate so important?
Well, basically, Jonathan, it's a way of using public food provisioning in a shorthand fashion. It's simply that, and I think the public plate is so important, so socially significant, largely because of the special nature of the beneficiaries. You know, in my own book, I look at pupils, patients, prisoners, and these are all radically different people, as we know. But I argue that they all have one thing in common. The common denominator in all these groups of people is that they're all highly vulnerable people, albeit for different reasons, but nevertheless, they're all highly vulnerable people in need of a nutritious diet. So that's basically it. You know, the public plate, shorthand for public food provisioning, public sector catering, if you will, the Cinderella of the food system, and the beneficiaries are special people. They're very vulnerable people. So in short, that's the way I've tried to frame the issue.
Thanks, Kevin. And you talk about nutritious food, and we're thinking about good food in general. I think it's probably worthwhile being upfront and really just saying what you mean by good food. What are we really talking about here?
Sure. You know, whenever I've presented drafts of this book, invariably this is always the first question to emerge, and for obvious reasons. You know, because it's such a bewildering issue, isn't it? You know, what constitutes good food? And I realized that this would be a challenging issue, and therefore I thought I'd better address it in the very first sentence of the book, where I say quite simply, you know, in certain circles, good food is synonymous with fine dining, exclusive restaurants, celebrity chefs, and so on. But in this book, it's understood in a simpler, more basic way as food that is appetizing, food that is nutritious, culturally appropriate and sustainably produced. Nothing fancy, but that's the basic definition of good food in the book. And I think that aligns with the way many people would probably think about it, in a regular sense of the term.
Yeah, thanks, Kevin. No, it's definitely a question that gets raised with the mission and Esther and our focus on obesity. But I think, at a basic level, there's a lot of overlap around what type of food we're talking about when we say good food. I think maybe moving on, it'd be useful to have a bit of a discussion about what the current issues are with public procurement and how it currently happens, and really how did we get here?
Well, it's a long story that I try to tell in an accessible way, because as I used to say to my students, I can never persuade them that public procurement is an exotic and engaging topic, but I do hope to persuade them that it's an important topic, because we spend a lot of money on public procurement. And in the food space, for example, it plays this vital role, as I said earlier, because it's deploying the power of purchase to deliver good food to often to vulnerable people, and in the book's case, in terms of schools, hospitals, and prisons, and in whatever country we're dealing with. And I've looked at this issue internationally. It seems that many public procurement managers and officers are all struggling with the same kind of challenge. And that challenge, putting it in the simplest possible terms, is that public procurement over the last 40 years, especially in the context of neoliberalism, neoliberal emphasis, context, where neoliberalism defined simply as that kind of philosophy which kind of lionizes the private sector and demonizes the public sector. So it's not a neutral landscape, but in that context, public procurement has been turned into what I call low cost catering, where low cost has been allowed to masquerade as best value, putting it in very, very simple terms. And the struggle within that period over the past 40 years, particularly over the last 10, 15 years, has been how to introduce values into the public procurement process other than low cost. And to recognize, in other words, that low cost ends up by externalizing some of the most important costs that we can think about in terms of human health on the one hand, but also in terms of ecological or environmental integrity on the other. And that's why we've seen the rise of what's called values-based procurement, rather than just value-based procurement in a narrow sense of the term. Values-based in multiple sense of the term, so we can factor in values other than just cost. Cost is important, of course, particularly in a cost of living crisis as we're living in now, but cost mustn't be the only value that is given weighting in our procurement or purchasing policies.
Thanks, Kevin. And what are the current implications of this focus on low cost? Can you paint a bit of a picture of some of the negatives we're seeing because of this potentially?
Well, if in the simplest terms, John, if we're simply awarding contracts to the very lowest bidders, then those bidders can't be doing a great deal about their public duty of care. This is what I argue in the book. And I in the introduction of the book, in a section called A Cautionary Tale, I show the tragic consequences of where low cost is allowed to masquerade as best value, and in terms of the health effects of that. Tragically, in a case in Wales, in the context of E. coli outbreak in schools, where dozens of children were hospitalized, and sadly, one 5-year-old child was killed. And therefore, this, I argue, all stemmed from a procurement culture which extolled cost, low cost above all other values. And yeah, it can lead to tragic consequences. So the challenge for the good food movement, if you will, is how to factor in other values in addition to cost so that we get some balanced or sustainable forms of food procurement.
And what does it look like when you do balance in these more values-based measures as well? Can you kind of paint a picture of, what some good examples of this might be?
Well, in the book, I look at organizations that are trying to do this. Throughout the book, I try to identify what the problem is in a particular sector, be it prisons, hospitals, food, schools, whatever. And then I try to address what I call the chinks of light, the social innovations that some organizations are practicing despite the system rather than because of it. And oftentimes those social innovations revolve around organizations oftentimes working in concert with civil society bodies, NGOs and the like, and they're trying to factor in these other values. And if we can take one example that I look at in detail, in the United States, we've seen the rise of what's called the Good Food Purchasing Program. It's one of the best procurement programs I've seen. That's one of the best in the United States, as is the Food for Life program in the United Kingdom. They have some similarities there. But in the case of the American program, the Good Food Purchasing Program, there's an attempt to introduce 5 values other than cost into the purchasing program. Those values from memory are a local economy, environmental sustainability, a valued workforce, sound nutrition, and animal welfare. So that's a lot to think about. And I argue that, while it has a lot of merit to that kind of purchasing program, it also creates challenges as well, not least that you need a procurement workforce which has the competence and the confidence to draw up contracts which embody those values. And that's easier said than done, Jono.
And public bodies in the UK are obviously really quite stretched financially. So I'm interested, and you can see why there is this kind of push towards low cost. I'm interested to understand how public bodies are managing to overcome that kind of cost constraint and take this more values-based approach.
Well, I take 2 kinds of organization, public bodies, which are trying to lead by example, if you will. I look at certain municipalities. On the very first page of the book, I raise the issue of the municipality of Oldham in Greater Manchester, because Oldham was always an instructive and inspiring example for me. I liaised with the catering workforce there for many, many years, because Oldham is an example of a municipality which won a gold award for its school food service, and yet it was dubbed the poorest town in England. So that showed to me that, poverty alone, a deprived community, could still design high quality services. And I tell the story of Oldham and compare it with the story of Malmö in southern Sweden. Sadly, Oldham was not able to sustain that performance because it was part of a national system, England, which had denuded the capacity of local authorities to develop capacity and capability. And sadly, by the way, since my book was published, I've learned that Oldham has decided to close its school catering service, despite the fact that it was an award-winning service. It was caught in that pincer movement between escalating food price inflation on the one hand and a declining number of schools that were subscribing to its service. and that made it fiscally unsustainable. That contrasts with Malmö, which is a strong city in a strong national system, where, as you know, Jono, it's universal free school meals in Sweden, paid for out of general taxation.
Mhm.
But Malmö excels even in that national system. And that's the holy grail, I guess, for school food reformers the world over now.
Mhm. And perhaps what can we learn from some of these international examples from the US and Malmo about how we might be able to improve public procurement in the UK?
Well, I think there's both a local and a national side to that story, John. At the local level, as the story of Oldham revealed, there was no mystery to their success. The leader at that time was a force of nature called Anne Burns, and Anne Burns led a catering team which had the professional competence and confidence to deliver this first-class service. But Anne always told me she couldn't have done it without politicians having her back. She
Mhm.
knew that politicians in Oldham was committed to the service at that time. So a high caliber catering service, a politically supportive local authority, and building supply chains with local or regional suppliers with whom she had worked for many years to get good deals. She wasn't spending a huge amount more than the average for the region, but
Mhm.
she'd crafted a school food ecosystem, if you will, which was delivering high quality in a cost effective way. So we can learn from those ingredients, pardon the pun, about the local catering system, but that needs to be underwritten, it seems to me, by a national system which sets standards and funds a system which means it's viable, unlike the school food system in the UK today, particularly in England, which is underfunded compared
Mhm.
to the school meal system in Scotland and Wales, for example. So there's two sides to the answer, John, I think, for what makes a viable, fairer, more sustainable system. Local competence and commitment, political commitment, and a national framework which
Mhm.
which which fosters rather than frustrates good local practice.
Thanks, Kevin. Yeah, I think that reliance on enthusiastic individuals driving change is something that we come across quite a lot, and definitely something that I've come across in my own work in the school food system. So yeah, really, really interesting to think about how we can move beyond these individuals and allow kind of more long-term and systemic change, I think. I guess one thing that also resonates with me is from your book is that in our work in the Healthy Life team, we're very focused on the issue of obesity and its impacts on health. And obviously better public food procurement, as you say, is not just about public health. There's also opportunities across multi-issues, sustainability, policy, poverty alleviation, local economy. And I think most of the time, what's good for one of these issues is good for others, but that's not always the case. So I'm really interested in any examples you've had of organizations who have managed to kind of work in this multi-issue way and manage some of these conflicts.
Well, I tried to give a few practical examples. For example, in the healthcare chapter, where I've worked with some of these social innovators over many years, and I give two examples. Some people on the call may remember a very famous story around what was called the Cornwall Food Programme. The health trusts in Cornwall had begun to pioneer a new locally sourced menu, drawing on shorter food chains, and that began to pay dividends in terms of satisfaction of patients in hospitals, whether it was local ice cream, whether it was vegetables, whether it was locally sourced meat or whatever. And that had all the hallmarks of a wonderful local food microsystem beginning to emerge, which was pioneered by kind of judicious and innovative local food procurement in Cornwall. Sadly, like many of these local examples, it petered out because of the churn of local managers in Cornwall, the indifference, frankly, the indifference from the NHS in England, and that revealed the challenge in all these cases, John, because I also look at North Bristol NHS Trust, which again did something similar in the west of England. These local innovations begin to peter out for two reasons above all, I argue. Number one, the passionate team that worked with purpose, that did the social innovation, whether it was in Cornwall or in North Bristol, they retired or moved on. And the practices that they introduced were never embedded in the organization so that it could outlast the team that introduced them. So that was the local reason for the failure. And then nationally, because of national indifference. And that's why I say in the book, whether it's in schools or hospitals, we can say that good practice has been a bad traveler, because we failed to identify the mechanisms and the networks which can replicate local innovations so that it becomes the systemic norm rather than the exception.
Thanks, Kevin. And who do you think is responsible or in a good position to help that good practice to spread throughout the UK? You mentioned lots of quite local examples. So interested, what government, third sector organisations like Nesta and also potentially the private sector as well could do.
Well, I think there's two parts to this answer, John. On the one hand, it's important for us to recognise that when these bodies, let's say health trusts, when they begin to innovate, when they begin to try to develop fairer, healthier, more sustainable food systems, it's invariably in a partnership with bodies like yourself, with people like either Nesta or the Soil Association or Sustain, food-focused NGOs, charities, call them what you will, because the problem seems to be that public organizations are deeply challenged by dealing with novelty. That the day-to-day inertia in the system is so overwhelming that it's very difficult for them to introduce novel ideas from within, unless, of course, they're triggered by a crisis like COVID, when old habits are abbreviated and new things are tried because of a needs-must imperative, as it were. But when novelty emerges in these public bodies, at least in the stories in my book, it's oftentimes in concert with NGOs like yourself. But that helps to explain a local innovation, but it can't explain why these often fail to become mainstreamed or scaled or replicated so that they become national in scope and character. And for that, you need national organizations, whether it's a government department or an association or whatever. Because in the Basque Country, when the Basque government identifies a good local innovation, they immediately try to identify networks and mechanisms that can spread and share that good practice. So again, good practice then becomes the norm and not the exception at the national level. And this is the way I think we need to think about the good food revolution in public bodies if we want it to spread and become more consequential than a mere local innovation.
Mhm. Thank you, Kevin. Just before I move on to my next question, I'd just quickly like to remind our audience to please join that conversation by submitting any questions in the comments on the right-hand side of your screens. And we have had some people sending in questions before the event as well, which I just wanted to move on to one of these. There's a question that we had around budgeting cycles, which seem to be a bit of a threat to long-term decision making. So the question is really, what is the key to scaling these public procurement solutions with an awareness of budgeting cycles and funding?
Well, if we take the NHS, the National Health Service in the UK, I think the single most important thing is for national management to recognise the importance of some of these local innovations, as happened in Cornwall, as happened in Bristol, and in other hospitals around the country. In Nottingham, for example, all of these developed in silver or gold awards in terms of the Food for Life programme, but they were allowed to wither locally because of a failure, because of a fragmentation, if you will, of the NHS as an organisation. It's very difficult for them to disseminate innovations nationally unless they're triggered by a crisis, as I say, like COVID or something like another kind of epidemic. So we need to think of those mechanisms which can share and spread good practice, and then design budgetary systems which are aligned, which allow these innovations to emerge. You know, I say in my book talks, the very first food program, a food report that I ever did, dealt with the impossibility of getting local food into a local hospital in Powys in Mid Wales. And one of the reasons for that was because the NHS auditing conventions were unable to recognise the benefits of nutritious food because of such a narrow, low cost conventions in the auditing system. They weren't able to recognise the health benefits of nutritious food. So as well as having the innovators, we need the managers to recognise and scale, and we need the financial systems to be sufficiently enabling and capacious to recognise novelty and to encourage it rather than to stymie it.
And have you got any, from your international examples, is there any examples of budgetary systems that are better allowing this than perhaps that we're seeing in the UK?
Well, I spent a lot of time looking at the case of Malmö in Sweden, as I mentioned earlier, because it's one of the most impressive school food systems that I've seen anywhere in Europe. There are other examples, of course, but you know, I happen to know the Malmö catering team and was able to work with them. But there is a financial system which tries to recognize and to enable the kind of broad goals of the school food system. And in Malmö's case, they kept the goals and aims very simple and very clear. They had two goals. Number one, to source organic food over a period of time, that they would try to go fully organic, because that would enable them to meet their second goal, which was to radically reduce the carbon footprint of all public food being procured in the city. Those two clear goals: organic food on the one hand, and low carbon footprints on the other. And one of the ways that they managed to hit those targets was by reducing meat in the diet. And that enabled them to mix plant-based protein with meat-based protein and to reduce the carbon footprint, to make the menu cheaper, healthier, and more climate friendly. And that's one of the messages, of course, for an organization that I've liaised with called ProVeg, which are trying to do the same in the UK working with schools and catering companies.
Mm-hmm. And you mentioned there was a focus on organic in Malmo. I've heard some examples of challenges that local authorities or other organisations are having actually being able to get enough organic food locally. Is that a challenge that they came across in Malmo, and is there anything they had to do to kind of address this challenge?
It was a huge challenge in Malmo, and it's a story which highlights the trade-offs that we often have to make when we're trying to balance the values of sustainability, because initially there was very little organic food which was locally available, and therefore they had to source it from wherever they could find it. And by sending out those signals to producers in the region of Skåne, they were able to slowly build up a local supply of organic food as well. But local isn't extolled over other values, and they try to have a balance between national sourcing and local sourcing. But this highlights the challenge for procurement officers, Jono, because it's an attempt to try to encourage officers to strike a balance and capture as many of these values as is possible. You know, the health benefits, the environmental benefits, all 5 of the benefits that I mentioned earlier that inform the Good Food Purchasing Program in the United States, which is another program which merits attention and adoption, it seems to me.
Mm-hmm. Thank you. And earlier on in our conversation, you mentioned around a challenge related to a kind of gap in procurement skills within local authorities. I was wondering if you could touch upon that in a bit more detail and kind of what kinds of skills are currently lacking and what can be done to address that.
This is a huge problem, it seems to me, particularly in the UK, where 40 years of neoliberalism has denuded capacity and capability in the public sector, right across the public sector, regardless of what subsector, whether it's schools, hospitals, prisons. And if we really want to build a good food system, by which I mean a system which is fairer, healthier, and more sustainable, then we need those skill sets within the public sector. Because many of the men and women who are currently in charge of the power of procurement, the power of purchase, as I call it, have themselves been weaned on a very, very low cost paradigm, where low cost is extolled over other values. And the challenge more recently is how to recognize social value and how to attach certain weightings to those values, that whatever we deem to be important. And one of the skill sets that I always thought was most needed, if you will, but but very hard to come by, was what we might call whole life costing skills, so that you could cost a product over the life course of the product rather than thinking of the cost in an upfront sense. And that would allow procurement managers to factor in more sustainability values rather than simply cheap upfront costs, or the costs that look cheap initially, but maybe over time it had dangerous side effects. For example, like ultra processed food, for example, and allows the procurement department to begin to factor in values other than cost. And I give examples of these bodies in the book, both in schools and in hospitals and prisons.
Thanks, Kevin. We're just about time to open up a bit more to the audience questions. So I just want to remind the audience once again, please do submit any questions you've got in the right side of your screen. We've got an interesting question, I think, from Aaron Tyndall. We've obviously talked a bit about local authorities already, but Aaron's asking what the role could be of combined authorities in the food system.
Well, Aaron, that's a really fantastic question. If I can give a give an example of what I mean here. There's enormous potential for tapping the new combined authorities and using them as a mechanism or a network to scale up good practice. And many years ago, I wrote to Andy Burnham's team to ask them why they weren't trying to spread out the Oldham school meal system to Greater Manchester. And I was told that although Andy Burnham appears to have a wealth of powers at his disposal, the fact is, even in a combined authority like Greater Manchester, which is probably the most advanced in the UK, because they were the first off the blocks, weren't they? And they've done very, very well subsequently. Even then, they recognised that local authorities were pretty sovereign bodies, and that Andy Burnham wasn't able to simply issue a diktat to all the other 9 authorities in Greater Manchester to say you must adopt the Oldham system. Unless you can win hearts and minds for scaling, then the prospects of moving from the local to the regional, let alone the regional to the national, are very slim indeed, I'm afraid. But in answer to your question, yes, I see enormous potential in the new combined authorities for scaling good practice, because they allow us to move from the local to the regional level in a way that wasn't possible before.
Thanks, Kevin. And we've got a question here from Cassandra Ma, who's asking what your thoughts are on the evidence related to values-based public procurement and how this can generate positive spillovers and local economic growth.
Well, thank you, Cassandra. Another great question. Yes, the spillovers are already happening, it seems to me, and I give examples of them in my book. Whether we're thinking of, let's go back to the Cornwall Food Programme or the North Bristol NHS Trust. You know, these are they were two highly innovative organizations which began to do local sourcing using fresher ingredients in the menu, and not surprisingly, lo and behold, patients preferred them. You know, what a surprise, eh? That patients appreciate good food cooked from scratch, utilizing local ingredients with positive spillovers for the local economy, which is particularly important in a poor rural economy like Cornwall, for example. As beautiful as the landscape is, there's a lot of poverty behind that beauty. But this was a way of trying to capture the spillovers, or the multiple dividends, as I call them in the book, the multiple dividends of sustainable food procurement, not least health, local economy, for example. And then maybe the best example of all is the Good Food Purchasing Program in North America, where they aim to secure 5 values out of that, which is challenging, I admit, but at least they're recognizing the need that that we need to capture more than cost. And while it's a juggling act to juggle 5 different values, it can be done where you've got the competence and the confidence to deploy the power of purchase with a sense of purpose.
Great. Thank you, Kevin. So we've talked a bit about kind of devolved powers, and I've got an interesting question, I think, from Tilly Robinson Miles, which is talking about the Good Food Nation Scotland Act. And Tilly's saying that a big challenge in relation to this and implementing it is to diversify this work beyond catering public procurement. Have you got any examples of ensuring relevant authorities think and act in a systems way in relation to food?
Well, Tilly, I talk about the experience in Scotland as being, a pioneering experience for everyone in the UK, because Scotland has really set the benchmark for how to create a national framework which is linked to, local obligations on the part of local authorities, health boards, for example, to develop good food plans. And I know these are early days, but it seems to me that that's the way forward. And we in Wales are hoping to emulate the Good Food Nation Act as soon as possible. Sooner the better, in my view. But in terms of taking a system view, I think this is essential if we are serious about transitioning to a sustainable food system, where you need a whole food approach, if you will, to this issue, because we need to involve more than public sector caterers, as you say, and we need to spread this out to the private sector, simply because the public sector is such a small niche in our food system. But by sending signals to private sector suppliers who supply the public sector, at least that creates a ripple effect. And creating new ripple effect seems to me to be the way in which we get transition. And I give examples of this from, some of our very best food NGOs, like the Soil Association and Sustain, for example. If you think of what Sustain has been doing with a good food strategy for London, it seems to me, what they've done there is truly innovative, and something that the whole good food movement can learn from their experience, because by publishing a map of all 33 boroughs and showing leaders and laggards, as it were, in terms of progress, they've created a ripple effect, and that's created a race to the top, in my view. It's raised awareness, it's galvanized action, and it's catalyzed change. And that links to the role that Nesta plays in the system with its 3 missions. And Nesta's philosophy is a good one, it seems to me, when it thinks about the 3 tasks of to inspire, to enable, and to deliver where others fail to deliver. That seems to me to be the ideal methodology of an NGO with purpose.
Mm-hmm. Thanks, Kevin. You talked a bit earlier about the NHS and some examples of NHS not really in certain areas not really taking on this. And we've got a question from Sandra Beaton, who's asking if there's any work underway linking some of the hidden costs of low-cost procurement to, I guess, NHS costs. So I assume she's thinking about the kind of health impacts of low-cost procurement, and therefore what the NHS could benefit from taking more action here.
Well, the short answer, Sandra, no, I'm not aware of any work trying to do this. But you would have thought it would be going on somewhere, wouldn't you, in the NHS? I mean, there was the sustainability unit in the NHS, wasn't there, or an improvement unit that was wound up a few years ago, and I think wasn't it collapsed into, was it the greener NHS in England or something along those lines? You'd expect whoever's in charge of sustainability in the NHS in England to be grappling with this question, because it goes right to the heart of the problem, doesn't it? That in my book, I argue that the NHS in the UK is being set up to fail. Why is that? Because it's being asked to supply a clinical solution to a societal problem. The problem of an epidemic of diet-related diseases, fueled now by the spread of ultra-processed food. And I call that, a Sisyphean task, because I couldn't think of a more appropriate metaphor than poor old Sisyphus, condemned for eternity to roll a boulder up a hill only to see it roll back down again. And Sisyphus became an emblem of futile labor. And it seems to me that's what's going on in the NHS. For all the fantastic work that people do in the NHS, ultimately it's a Sisyphean task unless we start to shift our investment to prevention rather than treatment, because that's the way to solve the dilemma of the Sisyphean task. And there's no solution to that task without the good food movement, without the NHS treating nutrition seriously and giving it parity of esteem with medicine and drugs.
Thanks, Kevin. Yeah, and that definitely echoes Nesta's approach in our Healthy Life team, and where we really find strong evidence that there is a need for more focus on the food environment rather than treatment if we're going to tackle obesity in any meaningful kind of way. We've got a question going back to schools from Kay Wenger, who's asking, outside of a new national funding framework, what are the ways you have seen for schools or local authorities to secure funding for better school meals programs, whether that's by financial or by political means?
Well, thanks, Kay. This is an incredibly timely and important question. Sadly, things are getting worse. If you take the fantastic report that was commissioned by School Food Matters recently, I think it was called The Cost of a Meal, which showed that the cost of a meal was significantly underfunded, particularly in England. Scotland and Wales offer higher rates than what's being offered in England, as you probably know. And because of this underfunding, and because of let's call it the dilemma of Oldham, caught in this pincer movement between food price inflation on the one hand and a declining number of schools that are subscribing to the service on the other, it's leading to local authorities like Oldham, Hampshire, Cheshire East, following Manchester and a bunch of other local authorities who are actually withdrawing from the service. So it's going the opposite way to what we should do, what we'd expect. Certainly what I personally would want to see. And my fear is, unless this trend is arrested and reversed, then it's not fanciful, in my view, to think that school food catering could go the way of adult social care, where it could begin to shrink to the point of oblivion. Now, that's some time off, I know, but the fiscal crisis of local authorities, Jono, is so acute in the UK, particularly in England, that I fear for the future viability of the school food service as a municipal service. And that's why organizations like APSI, the Association of Public Service Excellence, are right to be worried about this and are trying to address it. But to go back to Kay's question, I honestly don't see at the moment any urgency certainly in England, about addressing the underfunding of the school food service. And if you remember, the Starmer government has decided not to roll out universal free school meals to primary school children in England as a national scheme along the lines of Wales and Scotland, because they say they don't need to do so, because they're introducing free breakfast clubs instead. And while breakfast is an important part of the day, of course, you can't pretend that it's the nutritional equivalence of a hot midday meal. So they shouldn't be treated as mutually exclusive. Breakfast and a school lunch should be part of a food offer, and ideally, in my view, funded out of general taxation and treated as a universal free school meal system, as Wales and largely Scotland is doing in their context. So sadly, we're not seeing the kind of urgent action that we need to see right now, Kay, at least in my view.
Mm-hmm. And Kevin, you mentioned the higher rates of funding in Wales and Scotland. Have you got any evidence, anecdotally or otherwise, of how this is leading to better delivery?
The short answer is no, John. The evidence base hasn't been assembled to my satisfaction. Anyway, you know, the system was evaluated in London. It came out with in fairly glowing colours, it seems to me, and now it's been evaluated in Wales. So this evidence will begin to emerge, but we can't assume that because we've got universal free school meals that the quality of food is as good as it should be. And therefore the challenge in Wales and Scotland is to ensure that quality is continually improved. We've got some wonderful programs to do this in Wales, not least Welsh Veg for Welsh Schools, for example, which is trying to build more locally produced vegetables into the Welsh school food system. And that's another good example, John, of where public procurement needs to be integrated with supply side policies to promote horticulture and with consumption side policies to encourage children to eat food cooked from scratch, when in very poor areas they may have been weaned on ultra processed diets.
And I know alongside the extension of free school meals to being universal in Wales, they also offer a higher amount of funding per meal in Wales to other parts of the UK, which I'd be very interested to see in the future any evidence of the impact that can have on the quality of the food that's available.
Yeah, that's going to be one of the big questions going forward, Jono. My own concerns are that the universal free school meals program in Wales, which is unique in the UK in the sense that Wales is the only nation in the UK to have rolled it out to all state-funded primary schools. If you remember, Scotland is still waiting on its final two years before it rolls it out to every primary school. My fear in Wales is that it will die with this Senedd. You know, the next Senedd election in next year will be a radically different Senedd, a radically different parliament. And I don't know whether we'd get the cross-party cooperation that we need for a universal program like this to get off the ground. But, you know, hope springs eternal.
Yeah, definitely. And the hope is that, you know, some evaluations will be able to show the impact it's having, which will help make a case. We've got a question here from an anonymous LinkedIn user that's asking whether you think that the potential improvement in food in the US will help change things here. They're thinking of Senator Robert Kennedy in brief. So I think the question's related to, you gave some examples of the US and whether we are learning from the US examples.
Well, at the moment, Jono, I wouldn't counsel anyone to learn about the US example, given what's going on. I mean, there's absolute chaos going on within the public sector in the administrative state, and you know, Kennedy is bonkers on many issues, but for once I agree with him on the role of ultra processed food. And that's going to be a very interesting debate to see how Trump's two major allies, Kennedy on the one hand and Musk on the other, they have radically different philosophies of how to approach diet-related disease. Kennedy wants to do it through better diets, which I think we would support. And Musk wants to do it through injections like Wegovy, for example. So that'll be interesting to see how that pans out. But no, I'm not looking to the US for lessons at all here, unless we're looking at things like the Good Food Purchasing Program, or New York City, or food policy councils, all of which are threatened by Trump's crusade against the administrative state.
Thanks, Kevin. And thank you, everyone who's joined us for this interesting discussion. We are getting close to time, so I'm going to have to draw today's chat to a close. Kevin, I just wanted to check if there's any final things you wanted to talk about or say that we weren't able to cover.
No, you've been pretty comprehensive and very exacting, John, I must say. But the only point I'd want to raise for colleagues on the call would be to recognise the enormous gap, and sadly the growing gap, between, let's call it, the evidence base on the one hand and the political will to act on it. The evidence base is accumulating about the role of bad food policies and creating the harms in terms of either human health or ecological damage, for example. The evidence base is accumulating all the time. The jury, as they say, is in on all that, but the political will is getting weaker by the day, it seems to me, because of the green backlash against Europe and the rise of populist parties that are not just against immigration, but they're against the green deals, and they're against public policies for good food as well, John. So I'm concerned about that as much as anything, because we need to bridge that gap between the scientific evidence base on the one hand and the political will and capacity to address it.
Great, thank you very much, Kevin. Thank you again. And yeah, just say I did really enjoy reading your book. It was very interesting. So would urge anyone else who wants to learn more in the audience to pick that up. But now we've reached the end of the event, and I'd be really grateful if those joining us in the audience could please fill in a short survey. The link's going to be shared in the chat shortly. And as a thank you for filling out the survey, you'll be entered into a prize draw to win a £50 bookshop.org voucher. And if you haven't already, please do sign up for the Neston newsletter, and we'll let you know of any upcoming events in the next few weeks. The link to our newsletter is going to be posted in the comments section on YouTube and on LinkedIn. So thanks again, everyone. I hope you all have a lovely afternoon,